Okay. Okay, now we're going to talk about change in mental status and how to approach it, what we need to think about, what things we need to make sure have been done and looked at as part of the reason why the patient's having a change in mental status, and trying to prioritize those things, all right? If you are a physician, what guides this workup is your differential diagnosis. So that's where these tests and everything come from, all right? If we were a more physician-based team, then what I would take you through is a differential diagnosis for change in mental status, all right? But for application reasons, what we're going to do is just focus on the workup and the things that you need to be thinking about from that angle. What I usually like to do is have people assume that you're going to be working with a partner, all right? Usually we're not out there alone. You know, you've got at least 2 people. So the general approach is that one person is managing and starts managing things like the airway and breathing, all right? And the second person is making sure that either this workup has already been initiated or they're initiating it, okay? So we usually look at team mate person 1, and they are going to assess the patient's airway, okay? Obviously, you can't go any further if you're not happy with the airway. So if that means that all you have to do is a jaw thrust, all right, fine. Then you're taking care of it, and now you can go on. If it means that you need to stop and establish an airway, either with bag valve mask or going ahead and intubating the patient, then that's what you do, okay? And obviously, you assess their breathing, and you're going to assess the circulation and intervene if you need to give a fluid bolus, you know, whatever you need to do. So one person needs to be focusing on the patient's actual ABC status, and if everything is looking satisfactory, then that of course leaves the second person completely free to start looking through and trying to find reasons for why the patient is how they are. So if you look at, again, all this is coming from the differential diagnosis of why the patient has the change in mental status. But the first thing you want to do is check a glucose, all right? And you want to do that by AccuCheck, okay? You do not want to wait for the chemistry profile to get turned around and come back from the lab, all right? Just like you wouldn't wait for the airway to be managed, you know, by somebody else and not do anything while you're waiting for that. You don't want to wait for the glucose. Why? I mean, it's something that we can diagnose or find out immediately and correct immediately, okay? So that's what you want to focus on. You want to, this workup's going to go in order of ease and rapidity of finding an answer and ease of rapidity of addressing the problem, okay? So the first thing you want to do is check a glucose, and you want to do that with an AccuCheck or whatever you want to call it, okay, but by immediate bedside analysis. The next thing you want to be checking on is the electrolytes, okay? The ones that can be usually responsible for a change in your mental status is sodium, and that's a change in mental status without other obvious problems, okay? You want to look at your bicarb. If you have a severe acidosis, that can be part of the problem. If you want to look at your, or excuse me, you'll want to look at your BUN. If that's high enough and off kilter, that can cause your patient a change in mental status. Usually that will, well, it doesn't necessarily have to, but it can go along with an abnormal creatinine, which is why you can't clear the things you need to clear. The other 3 electrolytes that we often don't think about, okay, but we should, especially if you have a change in mental status, all right, is your calcium, your magnesium, and your phosphorus, okay? The reason you want to specifically order those or make sure they have been ordered is because they can actually cause a seizure, all right? They can actually be responsible for the change in mental status. They do not come with a normal, whatever you want to call it, Chem 7, basic metabolic profile, all right? They don't come with it. So the reason I stress this is because you're not going to find it unless you look, and you're not going to be able to look at it unless you order it. So it's one of those things, kind of like carbon monoxide poisoning, that unless your level of concern is high and you proactively do these things, the odds of you finding the problem are going to be almost nil unless you actively order them. All right? So if you have a patient who has a change in mental status, you want to make sure that, that the calcium manganphos is included in that initial lab work. All right? Okay. The next thing you want to do is go ahead and look at an ABG. All right? Again, these things should be all done simultaneously, right? I mean, you can get your Accu-Check, the blood, drop it on the an analyzer, from the same sample that you get to send your electrolytes and your blood gas, okay? So, it's all being done simultaneously. So you look at your ABG, and you're looking for, just everything that it provides, your pH, your PO2, your PCO2, your bicarb again, okay, and your base deficit if it's there. Again, why? Right? If you're grossly acidotic for whatever reason, that can be responsible for your change in mental status. If you're hypoxic without any of these other things, all right, that can be responsible for your change in mental status. So what you're looking for is, not just an assessment, but you're looking for an answer, okay? So we can do all those things at the same time, right? The same sample. Now, if you don't get a reason, okay, in general, what do? You keep looking, okay? So to me, I look at this as layer 1, all right? That's the first layer. Most of the time, without a specific history, all right, you're going to get an answer with this first layer of workup, all right? These are the things that are fairly easy to turn around, all right? You get your results back fairly quickly, and you can initiate a change and make a big difference in that person's outcome by looking at these things rapidly. All right? When you go to the next layer,